Good morning everyone and welcome to the pharmacology classes. The topic of today's lecture is neurodegenerative diseases, and these diseases include the Parkinson disease, the Alzheimer's disease, and multiple sclerosis. So these three diseases are very devastating and require the lifetime treatment and are connected with the loss of the uh, cognition and movement control. The classification of drugs includes the following drugs: the anti-Parkinson diseases include adamant, amantadine, that is actually antiviral disease, but its anti-Parkinsonic uh, properties were discovered uh, eventually. Then apomorphine, benztropine. Benztropine, I think, is familiar to you because it's the atropine derivative, and we recently discussed the benztropine. Then buperidine, bromkriptine. Bromkriptine is also familiar to you because uh, uh, it's a M choline blocker like benztropine. Then carbidopa is only used to treat the Parkinson disease. We will discuss it today very uh, uh, very in deep. Antacapone is very new drug, very expensive. Then levodopa with carbidopa. So carbidopa is actually not a drug that is used alone. It's always used with the levodopa. Uh, Pramipexole is also a new drug. Rosiclidine, rosa, rosagiline, and ropinirole and rotigotine is also a new drug. Sertraline is uh, pretty uh, frequently used for the treatment of the Parkinson disease, and tolcapone, like Antacapone, is a new drug, very expensive, and 3-hydroxyphenadiol is also used frequently. So these are drugs for the Parkinson disease, and then there is Alzheimer's disease, and anti-Alzheimer drugs include the donepezil, galantamine, rivastigmine, and memantine. So these drugs, galantamine and rivastigmine, are used commonly. Other drugs are new one, so less data is available on the efficiency of this one. The third group includes drugs for treatment of the multiple sclerosis and amniotic uh, sclerosis. So, and these drugs different uh, are different chemical structure and pharmacological groups and include azathioprine, cyclophosphamide, dalfampradine, dexamethasone. Dexamethasone is uh, uh, it's an anti-inflammatory uh, drug. dimethyl fingolimod, lotiramar, interferons alpha, sorry, interferons beta 1a and beta 1b, mitoxantrone, natalizumab. Natalizumab is a of antibody since produced by gene engineering. Prednisone is also anti-inflammatory, the same as dexamethasone, and teriflunomide is also a new one that is used for the treatment of the multiple sclerosis. And amniotic of sclerosis is the treatment of amniotic sclerosis. The riluzole is used. So this one is new one, completely new. So these are the classification of the drugs, and we will discuss the Parkinson disease. So the treatment of the Parkinson disease is based on the structure of the neurostriatum and substantia nigra. So neurostriatum and substantia nigra are both in the central nervous system, and they are connected to each other with the inhibitory dopaminergic neurons and inhibitory GABA neurons. Like GABA neurons are gamma aminobutyric acid neurons. So this is a common inhibitory neurotransmitter in the central nervous system. GABA is a classical inhibitory neuron. Sorry. And the dopaminergic neurons body is in substantia nigra, and they have connection to the neurostriatum, and they inhibit the transmission of the cholinergic neurons that stimulate the inhibitory GABA neurons that have connection to the substantia nigra and inhibit the substantia nigra. So the substantia nigra is inhibiting neurostriatum, and neurostriatum is inhibiting the substantia nigra, and these structures inhibit each other to reduce the excitation, and that leads to the regulation of the movement. And movement is going smooth. So all the movement that is voluntary is smooth. So this is a normal function. But during the Parkinson disease development, the dopamine neurons will die, and this leads to the reduction in the inhibitory action to the neurostriatum, and that facilitates the acetylcholine stimulatory effect, and then that inhibits the substantia nigra further. So, and this increase in the acetylcholine transmission impairs the movements and mobility. So one of the strategies to reduce the symptoms of the Parkinson's disease is increasing the dopamine uh, in central nervous system. So the dopamine is usually produced from the tyrosine that is converted to the dopa first, or the oxyphenylalanine dopa, and then to dopamine. Then it's released and acts on the dopamine receptor. So to increase the dopamine in the central nervous system, the patient is taking levodopa, that is uh, uh, that is the synthetic dopamine, and levodopa uh, is always administered with carbidopa to reduce the effect on the periphery, because dopamine receptors are also uh, uh, located in the peripheral tissues, and uh, the levodopa will result in adverse effects, side effects on the periphery, because of the metabolized in peripheral tissues and metabolized in GI. So to reduce that, we use the carbidopa that is not crossing the blood-brain barrier, and uh, inhibits the metabolism of levodopa uh, in peripheral tissues and in GI. So that results in the fewer undesirable side effects and allows to reduce the dose of the levodopa, so more levodopa will go to the central nervous system rather than uh, metabolized in the GI and peripheral tissues. But carbidopa is cannot pass the blood-brain barrier, and that is why we will not decrease the levodopa metabolism in the central nervous system. So that is why the levodopa will be still effective. The adverse effects of the levodopa include nausea, tachycardia because of the action the dopamine. The nausea is because of the action on GI. Tachycardia is because of the action on the heart, because dopamine is a catecholamine and has the same effect as epinephrine and norepinephrine. That leads also to the uh, hypotension, that is reflective, and some psychiatric problems may be uh, in there because of the action on the central nervous system. So the interactions of the levodopa include the interaction with the pyridoxine. Pyridoxine lead to the diminished effect due to the increased peripheral metabolism, and the monoamino oxidase inhibitors will, in combination with the levodopa, will indeed lead to the hypertensive crisis due to increased catecholamines. So that is why these drugs should not be combined. So um, another drug that is used for the treatment is cereglane. Cereglane is MAO-B inhibitor that increases the dopamine levels in central nervous system. So MAO A here is MAO A is used to metabolize the catecholamines like epinephrine, norepinephrine, and MAO B is mostly for dopamine. So the uh, the another drug that is used is Antacapone. So here uh, we can see the levodopa that is administered is metabolized to the uh, catechol O methyltransferase to the 3-oxymethyl-dopa, and then also inhibited by the carbidopa in peripheral tissues. So when peripheral dopamine decarboxylase activity is inhibited by carbidopa, a significant concentration of the oxymethyl-dopa is formed, which competes with the levodopa for active transport into the central nervous system. So and another drug that is useful for the treatment of the Parkinson's disease is Antacapone, because Antacapone inhibits the catechol O methyltransferase that decreases the plasma concentration of the oxymethyl-dopa, and that makes the central nervous system to take the levodopa in a greater concentrations. So actually this is blocked. So this is blocked by the Antacapone, and that is why Antacapone is combined with levodopa and further increases its concentration in central nervous system. So this is another drug to be combined with the levodopa. So the adverse effects of dopamine agonists include sedation and drowsiness, hallucinations during the sleep, and confusion during the day. So not recommended for the students, and nausea and vomiting after taking a meal, and hypotension. The adverse effects of acetylcholine esterase inhibitors like bromkriptine, bestropine include tremors, bradycardia, nausea, diarrhea. Anorexia is a disliking of the food, so decreased appetite, and myalgia. So myalgia is pain in the muscles. So what are your questions?
No questions, thank you.
No questions. So have you ever seen a Parkinson's disease patient?
No,
No. So
no. But I've heard of it. It's like when the limbs are always vibrating, and it happens only in old people, I think.
and what?
It happens only with old people, I think.
No, it's not only with old people.
Rarely in young people, but mostly in old people.
No, it's not mostly. It equally can happen in children, in adolescents, young adolescents, and older adolescents. And indeed,
Mm-hmm.
the hands are shaky. That's a common symptom of the Parkinson's disease, but it's not the only one. The patients with the Parkinson's disease cannot make some precise movements like uh, the buttoning the uh, t-shirt. So the shirt, they cannot button, so they cannot use buttons. It's strange because like they can make movements like that they don't need to think much about, like automatic movements, no problem with that movement. But when they try to make some movement like buttoning the t-shirt, they cannot do that. That is why they always have clips instead of the buttons, and then they cannot tie a tie, so on a shirt. That is why they have usually they use ties on elastic. So then they also cannot uh, they don't have strings on the shoes, so like they cannot make a knot on the shoes. So this is also a problem. And so any movement that requires a coordination, like uh, if they watch TV and they have a cup of tea nearby, they can watch TV and focus on TV and drink a coffee or tea automatically. But when they want to take a cup of the tea themselves, not automatically like a goal movement, they cannot do that. So this is a problem. So that is why uh, they usually cannot drive a car because a lot of movement is required, that is goat movement. But for automatic movement they are fine. So they can usually even walk, and the treatment is usually very effective, and usually there is no difference in it. But also they usually cannot write well, very well. So because precise movement that is goal oriented. So the disease was discovered about in 16th, and there were no treatment in 16th. Now there is a uh, very effective treatment, so that is why uh, the Parkinson disease is treated much better now. And then the Alzheimer disease is indeed only in old people. So Alzheimer disease we don't discuss today much about the drugs. So just the drugs are there, and there is a list of the drugs, and mechanism of action is completely different, so there is not much to discuss. So just it's very rare disease, and also treatment is very complicated. So and multiple sclerosis is the same. So there are drugs there, use any of them, good luck to you in the treatment. So because treatment is also not much effective, but for the Parkinson's disease it's effective, and also you you can think a little bit like about the combination of the drugs and other things like that.
But it's a chronic disease, right?
Yes, both. All of them are chronic. They can be completely treated, and the administration of drugs is lifetime. So I had some students with the Parkinson's disease in my group. So it's very common disease. Parkinson is actually very common. And Alzheimer disease is very common in old people. So we all sooner or better will have Alzheimer. And with the Alzheimer, the primary issue is the memory. So patients will forget the everything, like where they live, who is their relatives. So, and actually you have to remind them every day that you are the son or the daughter of them. So this is the problem with the Alzheimer's disease. So if they go out alone, they can forget where they live, and then they cannot find way back home, and then where they die. So that is why usually they have a special device that is connected to their body, so to check the body. So that is the case. So if you like see in the news that some old people go out and cannot be found, so this is probably Alzheimer's disease. So other questions?
None, I think.
Salma?
No, thank you, teacher.
Nothing. So like other questions on other topics, like about the test. So for today's practice we have a test. Test is at the educational portal, so you are welcome to start it right after the lecture. And so there are 4 topics: cholinomimetics, cholino antagonist, uh, cholinoblockers, then adrenomimetics and adrenoblockers. So and to start the test you have to pass the previous test. So if you fail the previous test, then you need to repeat the test and prepare for that first. So are there someone who passed the first test? Ahab, have you passed the first test? Anyone who passed the first test? So then if you don't pass the first test, then you need to pass that one, because you cannot understand what is in the second test without passing the first. So now please prepare for the test, and then if you have any questions, so let me know, I will answer the questions. So
Okay, thank you.
the lecture is over, so then see you next week the same time, and good luck to you to pass the test.
Thank you. See you.
See you. Bye bye.
Bye.
Goodbye.